everybody. My name's Grace Amadon, and today I'm very excited to speak with Dr. Sean Eagle. Dr. Eagle is an assistant professor in the Department of Neurological Surgery at the University of Pittsburgh. Today, he's going to be speaking to us about his talk at the upcoming SNS Symposium, where he'll be talking about reducing nihilism for management of patients with symptoms associated with traumatic encephalopathy syndrome. Dr. Eagle, thank you so much for being with us today.
Yeah, thank you.
So, just to kick us off here, can you provide a brief definition of traumatic encephalopathy syndrome for those who might be less familiar, and maybe talk a little bit about what do we understand about some of the symptoms that are associated with TES?
Yeah, traumatic encephalopathy syndrome has a consensus definition from the National Institute of Neurological Disorders and Stroke, where it's the in vivo clinical manifestation of chronic traumatic encephalopathy. It has a very broad definition, and in general, you have to have a certain number of required clinical impairments or symptoms and some supplemental impairments or symptoms. And these range from headache to suicidality to cognitive dysfunction and other aspects of neurobehavioral dysregulation.
Thank you so much. Are there any areas where uncertainty still remains regarding what TES is?
There are several areas in which we need to understand more about what TES is. The criteria have been criticized for being not specific enough. There are many people walking around exposed to repetitive head impacts or not with headache issues, depression issues, cognitive issues, and they have many diverse causes that aren't necessarily related to exposure to sports with contact. So we need to understand a lot more. Currently, the criteria do not perform well in predicting who will have CTE at autopsy and who will not. So clearly, that's the first open opportunity for improvement.
Certainly. And as you think about how research tends to inform clinical practice, and there's a lot of uncertainty for people who might walk into a clinical setting thinking, do I have this or not? How do you see providers starting to use this research evidence to help patients and families better understand some of that risk and uncertainty?
Yeah, I'm not sure we understand the answer to that question fully. This is an area that is rapidly changing and advancing quickly in terms of months, not even years, of new research and outreach to the public about research findings. I'm not sure we understand completely what clinicians who see these type of patients um, how they may be educating those, but I would argue that we all need to do a better job of educating ourselves and each other about what this research actually says rather than taking for granted what we're being told about this research and the conclusions. So I think as clinicians, especially neuropsychologists in sport, we need to do a better job understanding what this research actually says so that we can talk to patients who are inevitably going to be concerned about this.
And given this being the topic of your talk, what do you hope is a main takeaway that people can get away from your conversation at the upcoming symposium?
Yeah, it's baked into the title, but I would like to convey a sense of optimism to these folks. And I think clinicians have a real opportunity to help with that and understanding that there are multifaceted reasons for your current clinical picture. And depending on what you did after your contact sports exposure career up to your current point of different clinical impairments, there could be a host of reasons that your brain isn't working the way you want it to, or your behavior isn't quite tuned to the way you want it to be. And there are treatments for that. So I want to promote a sense of optimism for clinicians, and hopefully that gets translated to patients for talking about this syndrome and its long-term implications.
Yeah, that's really great. I am excited to hear about more of this talk and just be involved in the conversation as it's ongoing. Dr. Eagle, thank you so much for speaking with me. Certainly excited to hear more about the management of this for patients moving forward at the symposium in Cleveland this May. Anybody who's listening to this can read more about the conference or register to attend by visiting the SNS website. That's sportsneuropsychologysociety.com. And you can also follow us on SNS platforms or social media platforms like Facebook or X.